You're watching Arkansas Style on KARK.
Welcome back to Arkansas Style. For many women, the changes that come with perimenopause and menopause can feel confusing, frustrating, and even a little bit isolating, but they don't have to be. Two local healthcare providers are helping women better understand their bodies through education, community, and evidence-based care. Joining us now are Dr. Mandy Rice and Mandy Burton to tell us more about their monthly women's health classes and the resources available to help women thrive through midlife. Ladies, great to meet you.
Nice to meet you. Thanks for
Listen, power in numbers. I feel like so many women go through this journey alone. They feel like they're the only ones. Getting these women together, sharing stories, I mean, it's just support beyond belief. So Dr. Mandy, let's start with you. Kind of define the difference between perimenopause and menopause and what people are looking for.
Yeah, so in perimenopause is when our body's first making that transition from being a reproductive woman, like we were in our youth, being able to have babies, etc. And then now our ovaries are starting to fail us. I always say it's like they've picked out their timeshare in Destin and they want to retire, but they just make trips during the year and they haven't quite retired. And then menopause is after you've had 12 months of no periods, generally speaking, and now you've decided to move to Destin, Florida, and you no longer are at your home base, and now you're retired. So that's when the ovaries stop working pretty much completely, and that's the menopause itself. And then we're post-menopause after that. So perimenopause can actually be 7 to 10 years before we actually lose our periods, and that's what a lot of girls don't realize.
Girl, that's exactly what I wanted to talk about. You cannot fast forward that timeline. It feels like it goes on forever and ever. All right, well, Nurse Mandy, there are some interventions that people are offered, hormone replacement therapy being one of them. Your thoughts?
Yeah, so hormone replacement therapy is considered the gold standard to replace your hormones. However, there are a few patients out there that can't take hormones, and so there are non-hormonal options that work very well. Vaginal estrogen is something that 99% of women can take at any age. My oldest patient is 97 using vaginal estrogen. My youngest patient is 25 using vaginal estrogen after she's had a baby. So postpartum, in the postpartum time frame, that is when your estrogen levels are really low as well.
What are we treating when we're using that?
Vaginal estrogen is treating genitourinary syndrome of menopause. So it's the things that go wrong inside the pelvis in low estrogen states. Overactive bladder, leaky bladder, pain with intercourse, dryness, those types of things.
Ladies, these are not normal. I mean, they are normal, but they're treatable, I guess is a better way to say it. You don't have to suffer in silence with this. But Dr. Mandy, you also like to take a holistic approach. How do you do that?
So in addition to the hormones being replaced after we lose our ovarian function, it's so important to be able to move our bodies, feed our body the fuel they need, sleep well. So there's a whole component of factors that impact our health and our longevity, because we're not just looking at staying alive all these years. What is that health during those years? Is it good health? Are we living vibrantly? Or are we getting chronic diseases because we haven't had our hormones replaced, we don't move our bodies, we don't feed our body the fuel that it needs, like protein, fiber, water. So it's an approach that looks kind of at the whole person from the body, mind, and even spirit perspective so that we can grow vital.
So, Dr. Mandy, you know, as we talked about the timeline, it can be very long. The symptoms can be, you know, ups and downs and what have you. We can't constantly be calling our doctor and pitching our woes. You have these beautiful expos that you're offering and these women empowered talks. Let's tell ladies what that looks like and invite them to come participate.
Absolutely, we'd love to see you. So there's Mandy, nurse practitioner, and myself, and about 10 other providers that get together every month and just have a free 2 hours where we can talk about these things and share our experiences and our patients' experiences, and it's really a support group too. We do some of the didactic, we call it, you know, giving definitions, talking about how we can help our bodies, but the support group hour is so essential to help us make these networks and realize that we're not alone. We're going through this all together. If you're born with ovaries, you're going to go through the process. Whether it's difficult or easy, your body's going to experience it.
I would also like to say that the male counterparts are definitely
so
welcome. So if you are in a partnered relationship, please bring your male counterpart, because the last hour the men and the women are separated.
Yes, so we can speak about
what kind
things.
of feedback are you getting when you do these, Mandy?
Yeah, so the women are, telling us things or are able to share things in a setting of like-minded women, and so you feel like you're not alone. Most people, are brought up not to talk about these things, and this just gives them permission to share and learn and grow. And the men are, they're not back there bashing their women, they're back there also trying to find a support network to then support us as we're going through this shift.
All right, well, let's recap the details and invite everybody out.
Yeah, so our next class is on July 21st. We do it every month, so we'll tell you when the next one is, but the next one is July 21st in Hot Springs at the Muses Cultural Art Center, and we meet from 4 to 6 p.m., and we welcome everybody.
Well, ladies, I mean, literally we could devote the entire hour, the entire week to this topic. So many questions. Wonderful to have two professionals willing to give us the answers for free.
We'd love to help.
Beautiful. Thanks, ladies. Appreciate
Take
it.
care.
Again, if you're looking to learn more about women's health in a supportive educational setting, be sure to check out the upcoming focus group happening in July and watch for details about this year's Hot Springs Women's Health Expo in October. Now, coming up next, the Southern Cypri ladies join us in studio to share a festive way to elevate your 4th of July cocktail bar. We'll be right back. You're watching Arkansas Style.